Hokkaido University researchers found a new mechanism that's key to tumor metastasis and that also plays an important role in cardiovascular disease. That suggests that there might be a common treatment for these seemingly very different conditions. Scientists have been noticing for a while now that there are a few commonalities between advanced stages of cancer and cardiovascular disease like atherosclerosis. There are the facts that having one results in an increased risk of also developing the other, as well as an increasing number of cancer patients who die not of cancer but of cardiovascular disease. But also, there are a few molecular commonalities that made researchers from Hokkaido University look whether things they knew about the development of cardiovascular disease also apply to tumor malignancy. It's known that during the development of atherosclerosis, cells produce high levels of the molecule biglycan that binds and thus accumulates another molecule called low-density lipoprotein. As a consequence, the endothelial cells, the cells that line the inner surface of blood vessels, become inflamed and produce chemical signals that attract a class of immune cells called neutrophils. They oxidize the low-density lipoprotein, and under normal condition, that leads to its removal by other immune cells. However, if the endothelial cells overexpress a receptor for oxidized low-density lipoprotein, the receptor is called LOX1, that will lead to the recruitment of more neutrophils that start producing extracellular trapping molecules, which is a strong biomarker for the development of atherosclerosis. Now, high amounts of biglycan, the overexpression of LOX1, and the accumulation of neutrophils had recently been recognized as biomarkers for the emergence of tumor malignancy as well. However, little was known about the mechanism behind that, and what was known from the study of tumor cells alone. This is where the Hokkaido University researchers broke new ground by studying actual tumor tissue in mice and looking for the molecules they knew from cardiovascular disease. They found that, indeed, low-density lipoprotein accumulates and is being oxidized in highly metastatic tumors, but not in ones that are not malignant. They also found that LOX1 was overexpressed in endothelial cells of malignant tumors, as well as increased recruitment of neutrophils there. Thus, it's clear that much that we know about the mechanism behind atherosclerosis is also true in malignant tumors. They finally proved a causal link between LOX1 overexpression and metastasis by artificially suppressing LOX1 expression in malignant tumors, which led to a decrease in metastatic activity, while enhancing its expression also increased the production of neutrophil-attracting signaling molecules. They thus suggest that treatments affecting LOX1 expression in endothelial cells might both prevent the formation of a microenvironment favorable to the production of metastatic tumors and tackle atherosclerosis as well.